It's Tom Harris. I'm the director of the University Center for Economic Development and a state extension specialist. I'm also on the faculty of the Business School in Economics. And this is one of the current fact sheets we're developing right now, and I'm just going to make a podcast out of it. One of the areas we've been looking since the COVID-19 are different areas of areas that have been impacted by COVID, but also areas that we haven't looked at. And I thought I'd do it this time is look at the veterans of the state of Nevada, the economic impact of the veterans, and I'm going to specifically take a look at Churchill County for this podcast. Now, I have done this for all 17 counties. I got 17 fact sheets that are being developed. And if you want a copy, just at the end, I'll have my email and we can process your wishes and send you a copy for your specific county. The idea of this came working together. Most of us in Extension work together with different states, and one is with Mississippi State. I worked with Alan Barfield a lot, and Alan and I were talking about this, and he did something at Mississippi State that I'm kind of following here for the state of Nevada, kind of showing the different expenditures and how veterans do play an important part in our economy, not only as people who have volunteered for our armed forces, but their pension expenditures and other things, how they impact the local economy. Need to take a look at that. Now, just some interesting facts about veterans here. From the U.S. Department of Labor, there's in 2019, there have been 18.8 million men and 1.9 million women who are over the age of 18 in the United States are considered as veterans to the United States. During the Gulf War I, that's from August 1990 to September to August of 2001, and the Gulf Area II, September 2002 to now, there's been a surge of young people men and women who in the age of become veterans in our population. In 2019, to the U.S. Department of Labor, 7.4 million veterans served in these conflicts. In 2019, there were about 4.3 million veterans who served during Gulf War II, September 2001 to the present. 17% of these veterans, this is something that has changed since earlier wars. 17% of these veterans were women, compared to only 3.5% who are veterans during World War II, the Korean War, and the Vietnam War. And as we all very much aware that women play a bigger part in our armed services. About 2/3 of all Gulf War II veterans are between the age of 25 and 44. And these people are aging. They're also in the area of what the most productive time in their livelihoods. And as we know, we'll go through there's an aging process with our veterans. In 2019, 3.1 million veterans who served in the Gulf War I, the proportion who were women were 16%, which was similar to the kind of Gulf War area too. So women have been taking a bigger percentage of that in these last two wars. All of Gulf War I veterans were aged 35 and over in 2019. As we know, that was in the 1990s, and of course we're getting older, compared to 57% in Gulf War II. Nearly half the Gulf War I veterans were ages 45 to 54, 22% or 35 to 44, 22% 55 to 65, and 10% were over 65. So as you can see with the Gulf War situations, how the distribution of population, and they will have a different distribution of population in each county where we look here in the United States. However, like COVID, general national population, COVID-19 did hit the veteran population and their families also. When in 2020 began, veteran unemployment was about 3.5%. However, veteran unemployment rose to about 6.4% in September 2020, which is lower than the non-veteran of 7.9%. We're getting more current information here that we can update this. However, veterans who are 25 to 34 years of age have realized unemployment rates of 9.4%, which is higher than the non-veterans. And so that's just something we need to be aware of. I think people are talking about this, how we can serve these people. This following data and graphics discussions, we're going to talk after that. We're talking about the expenditures that people get for as being veterans. We're going to look at the demographics, and we're going to look at the economics of it and the fiscal, how they impact the nation and state. And more importantly, we're going to look at Churchill County during this period. And it's a 5-year period or more. And also how the period of the COVID-19 might have impacted this segment of our population. Of course, when we talk about Fallon, or Churchill County, we talk about the Fallon Naval Air Station, Top Gun School. These are areas where a military base does influence how many people are veterans and where they live. Sometimes there's a propensity for them to retire at the last place that they serve if they like the area. Fallon is one of them. And becomes a point of source of people who go back in the civilian labor force, become very productive workers or entrepreneurs that we need to be aware of that locate in Fallon. Veterans as a percent, figure 1 depicts as a percentage of total population residents of Churchill, the state, and the United States over a 9-year period from 2011-19. Churchill had a higher population of veterans compared to both nation and the state. The Churchill County veteran had increased about 3.6% over this 9-year period, from 14% to 14.5%, peaked out about 17% in 2015. However, over the same time period, both the U.S. and state of Nevada have have a different experience where they have seen population decreases of 19.4 and 24.5% respectively. So as a percent of the population nationally, the state's going down. And this is where you can say where you have naval bases or armed forces bases where it's higher, they're going to be impacted because a lot of people do retire there. But like everything else, people are aging in place. Many of our World War II veterans are also passing away. And this has also reduced the number of veterans per the population. But they still, in many areas, play a very important part. Veteran population growth, basically figure 2 depicts this veteran growth from 2011 as your base year. And Churchill, upon residents of Churchill County, Churchill is in this gray area here, and Nevada is the orange, and the U.S. is blue. So you can see the U.S. and the state of Nevada kind of follow. But you can see here, veteran population has increased with overall about 3.6% from 2011 to 2019 for Churchill County. But we have population decreases about 13.7% for the U.S. and the state and the state of Nevada and the U.S. So this probably doesn't surprise very many, but these figures do show these numbers have been declining a little bit. The total expenditures for veterans. Now, veterans do have expenditures. They get health expenditures, get education expenditures. Some of them are disabled and get some monies that way. My father, who was a prisoner of war in World War II, did receive some pension monies, and others also get pension monies there also. And the total expenditures, compensation, pensions, education, and other indemnities that the medical expenditures. Of course, if you have a VA hospital, that has a big impact on your county too. Department of Veteran Affairs experienced significant growth in expenditures per veteran for Churchill County, the state, and the United States. Churchill County's expenditures increased from $7,000 to about almost $11,000 in 2019, or a 59% increase. So expenditures per veteran have increased. There's a similar kind of case has been realized for the U.S. and the state of Nevada. And I think this is something that we're cognizant of, that we want to ensure our veterans are being taken care of. Compensation per veteran. This is also, again, Churchill County is leading. This is compensation to residents of Churchill County, state, and Nevada and U.S. Includes expenditures like comp payments, pension payments, dependency, those kinds of things. Mostly expenditures in this category reflect monthly payments to individuals. And the compensation we looked at per veteran is here in Churchill County in the state of Nevada and the U.S. Churchill County expenditure and pension expenditures per veteran increased 52% from $3,800 to almost $5,900 in 2019. This is expenditures that people can use, veterans can use, then are applied into the state and have an economic impact into the state and to the county, such as Churchill. Some of them might use this money for purchases of goods and services, as for the pension or some disability. Education, vocational rehabilitation, and employment expenditures are another one per veteran. A lot of our veterans do have monies to help them with their education. And so in Churchill County, you got Western Nevada Community College, Western Nevada College there that they would go to, or University of Nevada, Reno. But these are expenditures for a level of education, regarding education, vocational rehabilitation, employment expenditures per veteran over a 9-year period. And again, here's the United States. Churchill's a little below everything here, surprisingly. Over a 9-year period, Churchill County expenditures increased by 10% from $485 to $507 compared to the U.S., which is about $480 to $722. And so maybe some of these expenditures for us here are a little less in Churchill County than for the national and state average, but still, those are expenditures that are making it into the Churchill County economy. Medical patients as a percent of veteran population, again, this is something that's been very much addressed and continues being addressed of veterans who have come back injured, or those who are also looking for medical assistance. The unique medical patients of each respective veteran populations have all experienced increasing trends over the 9-year period. That was something that was being addressed, you remember. Churchill County's percentage of veteran medical patients grew by 24%, while the U.S. grew at 31%, the state by 52%. But you see here, you can see here in the later years, you've seen some growth here in the Churchill County. So that has been becoming more aware of there have been some criticism of the Veterans Administration, and that becoming better at helping veterans who seek help. Again, medical expenditures. Those expenditures are there. If you think of the VA hospitals, they are expenditures. You got doctors, they buy goods and services and everything there. And they're here, this is expenditures of Medicare, post-fund, medical, prosthetic research, those kinds of things. The medical expenditures per veteran in Churchill County has increased. Churchill County's medical expenditures increased by 47%, with medical expenditures growing from $8,000 to about $12,000 in 2019. Similar has been in these other cases here in these areas. So you can see veterans do play an important part in the national, state, and local economy with their expenditures. And looks like some of them have been growing as the time goes on. Now, as Gulf War II, people become older, and yes, they're going to have more expenditures on medical. And so all this has to be also tied with the demographics of our veteran population. Now, we use a thing called M-Plan. M-Plan is a model that does an input-output. It kind of looks at the economic linkages between, doesn't count, it does. It looks like the economic linkages between different sectors. So looking at the expenditures that have been in place for veterans, we found a direct effect in Churchill County of about 179 employees. Indirect are those business to business. If somebody went to a veterans hospital and the veterans hospital had to buy more paper to do more processing, they went to the paper store and got more paper. That paper store, now having more activity, may have to spend 1 or 2 more hours with an accountant. That causes him to expand. As you can see, it's a kind of a churn between businesses, business to business. And so from that relationship, there's an extra 6.1 employees. Now, UNI's induced, that's households, incomes. You and I get paid. What do? We go to a restaurant. We go to a restaurant and eat a meal. People need to buy meat. That causes further economic churn. Those are called induced effects. So from about 180 people directly, total economic impact of veteran expenditures in Churchill County is about 187 people. Labor income, this is employee compensation, proprietary income, about $12 million. Value added, that's value added is that added to added value after the cost of goods sold, about 14 million. And the output, the total output increase from these expenditures is about $21 million. So you can see the expenditures of our people, of the veterans, have impacts on Churchill County. Now, these are the individual sectors, how they impact. A lot of people talk about multipliers, and a lot of it's all right and good, but I always like to look at how the distribution, how is this distributed between all different sectors? And you can see health and social services are very much number one. I think you're going to see that even more as our veterans become older from the Gulf Wars and those. You're going to see more health impacts to them, and so there's also social service impacts as we realize. And so of this 179, about 106 are with the health and social services. 21 in education. Education could be, in that case, where people are going to learn vocational trade and those kinds of things, and retail trade and others. So you can see it's pretty well dispersed. And there's not only the veterans, but other people are being impacted by this. The next one is with the implant, we can do some estimations because of those expenditures by veterans. There are impacts to the federal government and local government. Of course, we don't have an income tax here in the state of Nevada, but when we buy goods and services, we have sales tax and property and other. So the expenditures that's made in Churchill County have about a $400,000 impact on state and local revenues, and about a $2.2 million impact in federal government revenue. So in a way, you can see what the government, the expenditures, when they go and give money to, receive their benefits, they make expenditures in the local economy. They cause a churn in the local economy. That churn in the local economy also causes a churn in taxes for the state and local and federal government. And so you can see how this benefits the economy. So how do is this not should be non-employers, but how do veterans, something got mixed up, sorry, how do these things impact, how do veterans impact economic strategies? Well, improve efficiency of existing firms. A lot of veterans are in business, and Small Business Development Center and others can help them become better business people. Improve the capture of dollars. Those expenditures by veterans in their expenditures, and also people who are being in medical, those expenditures, if they can be captured by the local government, so much the better. There's more economic churn. Attract new business basic employers. Well, again, veterans are very good employees, and they go work for employers in any kind of basic or non-basic business and increase the activity of local economy. Encourage business formation. These are areas where we can say these are small business people who can start new businesses, and they can be very good at this area. And increase aid received from broader governments. This is what we're talking about. Federal and state, whoever has programs for our veterans, how can these fit? And so veterans do fit an economic development program. They're an expenditure, they're an asset to your local economy as both employees and entrepreneurs. And also they bring money into the local economy that could be captured that can cause extra economic development. So in that case, that's if you have any questions, and I'm sorry about that last slide, but if you have any questions, I will thank you, and you can send it to me. You can see this is my address and my email, harris@unr.edu. We'd be glad to send you a copy of this if you request it. And this was also something that was paid by our EDA University Center grant and a special CARES Act grant that we received from the U.S. Department of Economic Development Administration. That's it.
Great. Thanks, Tom. I'll stop recording now.
I can't believe I had that. I thought I had that